coordinator. How's everything going today?
Everything is great.
Wonderful. Just let any one of us know if you need anything, okay?
I will, thanks.
You should have seen it. It was very funny.
And for once, we came early.
Greg! What's wrong? Greg! What's wrong?
Ma'am, I work for the venue. I can help.
Please help him.
Let's roll him over. Sir, can you hear me? Sir!
Sammy, this is Belinda. A guest collapsed in the event room. Please send the AED up.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yes, we just had a guest that collapsed and he's not responsive. No, we don't think he's breathing. Yes. We have another employee doing CPR on him.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19,
Excuse me, I
20,
need to get in
21,
here.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Folks,
Remove
please
clothes
follow
from
me.
patient's
Let's
chest.
give them some room to work.
Look carefully at the pictures
1,
on the
2,
white
3,
adhesive
4,
pads.
5,
Peel
6,
one white
7,
pad
8,
from
9,
the gray
10,
case.
11, 12,
Place
13,
pad
14,
exactly as shown.
17, 18, 19, 20.
When the
21,
first
22,
pad is
23,
in place,
24, 25,
peel the
26,
second
27,
pad.
28, 29, 30.
Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient.
Are you clear?
Press the flashing orange button now. Shock delivered. Be sure
Immediate,
emergency
high-quality
medical
CPR
services
and
have been
defibrillation with an
4,
AED
5,
from a
6,
bystander
7, 8,
can double
9,
or even
10.
triple the chance for survival from sudden cardiac arrest. Before anything else, pause and assess the scene for hazards. If the situation is dangerous to you, do not approach. If it is safe, quickly assess for responsiveness. If unresponsive, activate EMS and send someone to get an AED. Check for normal breathing. Do not be fooled by gasping actions. If not breathing or only gasping, begin compressions at 100 to 120 times per minute. Remember that quality matters. Push hard and push fast. Do not lean on the chest. After 30 compressions, give 2 rescue breaths. Establish an airway first and give only enough air to see the chest rise, but no more. Do this quickly in less than 10 seconds. Return to compressions and perform ongoing CPR cycles of 30 compressions and 2 rescue breaths. Compress hard and fast. Allow the chest to fully recoil to its normal position after each compression. Use the AED immediately when it arrives. Turn on the AED and adhere the defibrillation pads to the bare chest.
Stay clear of patient. Analyzing.
Allow the AED to analyze the heart.
Patient. Shock advised.
If a shock is advised, make sure you are not touching the person before delivering the shock.
Shock delivered.
Immediately after the shock is delivered, resume CPR cycles of 30 compressions and 2 rescue breaths. Voice instructions and additional analysis by the AED will guide you through further care. Don't stop until the person shows signs of life, another provider or EMS personnel take over, or you are too exhausted to continue. If a person clearly responds, stop CPR and place the person in the recovery position. leave the AED on and attached in case cardiac arrest returns. If a shock is not indicated by the AED, immediately resume CPR. Continue to follow the AED's instructions. Blood pressure is created and maintained with ongoing compressions. When compressions stop, pressure is quickly lost and has to be built up again. Avoid interruptions to maintain high-quality CPR. Performing effective chest compressions is tiring. When others can help, take turns performing CPR.
Analyzing heart rhythm.
Quickly switch compressions every few minutes. When possible, do this during the automatic AED analysis that occurs every 2 minutes. Do the best you can. A person without breathing or circulation will not survive without help. Nothing you can do can make the outcome worse. Compression-only CPR is an approach that is being widely promoted to people who are not trained in CPR. Simple instructions in compression-only CPR can be shared in many different ways, including social media and as public service announcements. EMS dispatchers can also provide compression-only instructions during an emergency call. However, compression-only CPR is a limited approach. At some point, rescue breaths are essential for all cardiac arrests, especially those involving an airway or breathing problem, or those involving children. As a trained provider, perform both compressions and breaths during CPR. If you are unable or unwilling to perform rescue breaths, you should provide high-quality, uninterrupted compressions at a minimum.